Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
From routine skincare to viral exanthems and even allergic reactions, there's no question that skincare is very confusing. I'm here to answer all of your questions about preventative skincare, routine maintenance, and treatment and more on this episode of Ask the Doc, No Appointment Needed. Hi, I'm Dr. Scarlet Constant, pediatrician and founder of Constant Care Pediatrics here in Miami. Today, I'm going to answer your questions about routine skincare, common rashes, viral exanthems, and more in pediatrics. Please send your questions in, and I'm happy to answer them in real time. It looks like we have a question coming in from Facebook now, and this question is from Haven. Hi, Dr. Constant. Our 6-month-old baby girl keeps getting red patches on her knees and elbows. How do we know if it's eczema or just dry skin? Well, Haven, eczema is a result of dry skin. And in babies, we tend to see that they develop rashes, which is called atopic dermatitis. It's a reaction when the skin is very dry. There's a little bit of inflammation, redness, and roughness that occurs on the extensor surfaces of the skin. That means the knees, the elbows, and also commonly on the cheeks. That doesn't mean that your child has a lifelong diagnosis of eczema. Atopic dermatitis can just be transient, meaning it occurs during early childhood or infancy as a result of dry skin, but it could certainly be prevented, treated, and even resolved before the older ages. So for now, I would suggest that you moisturize your child's skin. You make sure that you are using soaps that provide more moisture to the skin, put emollients on. And if the rash does persist or it is itchy or seems to irritate her or bother her, then we might want to step up therapy to maybe a topical steroid, but that would be at your pediatrician's discretion. I hope that this was helpful for you. We have another question coming in now from our All Health TV app. This is from Manolo. Hola, doctora. We just got a note from our kids' daycare saying that a couple of children have contracted hand, foot, and mouth disease. I got 3 questions for you. What the heck is it? How contagious is it? And what should we do if our kid gets it? Well, hand, foot, mouth disease, it is a virus. It is actually caused by the Coxsackie virus. And that is a virus that's very common amongst the toddler years. So you tend to see it in daycares, younger classrooms, maybe childcare facilities like the My Gyms and the Mommy and Me Play gyms. And this is because Coxsackie is transmitted by secretions, meaning nasal secretions or saliva. And that is how the Coxsackie virus will spread. And when the Coxsackie virus infects your child, they develop what we know as hand, foot, mouth disease, which are lesions that occur on the palms and the palms of your hand, soles of the feet, and then in some cases within the buccal mucosa, meaning within the inside of the cheeks, inside of the lips, the tongue, and even in some cases, the back of the throat. Now, this virus is particularly worrisome because these lesions actually burn and they hurt. And children tend to decrease their oral intake because of the ulcers or the lesions, that are found in their mouth. It's hard for them to drink. It's especially hard for them to eat or chew solid foods because it hurts and it irritates. And sometimes they might even bleed. And then they don't want to drink because they might have lesions in their throat that are painful to swallow. So we tend to see children develop dehydration due to the lack of eating and drinking when they have this virus. If you're so lucky that your child does not have any lesions in the mouth, they just have the lesions on the palms and soles, that's a little easier to manage because now we're just dealing with pain management, which you can give Tylenol or Motrin for the pain of these lesions. I tell you from personal experience, they burn, they itch, they hurt all at the same time. You can also see lesions on the body, on the skin, and some people confuse this virus with the chicken pox, but the way you can distinguish it is that these lesions don't actually crust over like the chickenpox vessels do. Chickenpox opens up and then crusts over, whereas with hand, foot, mouth, the lesions never crust over. They just look pustular and then they dry up and they go away. So again, to reiterate, that's the palms of the hands, soles of the feet, sometimes on the skin, and lesions within the mouth and the oral mucosa. If your child gets it, like I mentioned before, just supportive care. Take care of the pain, make sure you're hydrating your child. And if your child develops a fever with this virus, then you'll go ahead and manage the fever the way you've discussed with your pediatrician. Good luck. Okay, it looks like there's another question coming in from Facebook. This is from Whitney. Dr. Constant, our family has a history of allergic reactions to things like certain foods and insect bites. What are some signs my child is developing an allergic reaction? So, a lot of people confuse rash with an allergic reaction. And in an allergic reaction, it's important to note that allergic reactions are what we call IgE mediated, meaning our immunoglobulin E is what facilitates the response. It's important to know this because with that response comes swelling, comes redness, and something that we call urticaria, also known as hives. Hives are what indicate that there is an allergic reaction. A regular rash that you've seen before that is not hives is not indicative of an allergic reaction. And it is important to distinguish between the two. So if your child is developing an allergic reaction, you should see hives, which are raised lesions that are firm, red, and itchy. They are very itchy, and they occur right away. You're usually looking at within the first half hour of exposure to whatever the allergen was. So that is a very easy way for you to tell that your child is having an allergic reaction. So it seems like everybody has questions about skincare and rashes. We have a question coming in now, and this is from Sanjeev. Hello, Dr. Constant. Is it normal for a toddler to react to sunscreen? Our daughter, Nitika, seems to get a rash every time we put lotion on her. Are there certain ingredients we should avoid? Well, it's not normal, but it is not abnormal. If your child is having a reaction, please listen to your child and trust them. That means that they must be allergic to an ingredient in the product that you're using. Now, like I mentioned earlier, it might not necessarily have an allergy. If you see that there's a rash or irritation, it could just be an irritation or a sensitivity to the product that will go away and resolve once you remove the product. But if we are talking about an actual allergy, then your child should develop hives, itching, and burning. So some children could have allergies to zinc. Some children are sensitive to zinc or some of the preservatives that are in the product, and they will cause redness and irritation and burning. You could have like a chemical reaction, which is just like erythema or redness, like we mentioned, and a burning sensation. And again, it resolves once you wash the product away. Or we could have an allergic reaction, which is actually hives and eruption and itching, and that would be to a particular product in the sunscreen. So certainly review the products in the sunscreen and maybe switch over to a different type of sunscreen to see if your daughter has a better response. Okay, so it looks like we have a question coming in now from Giuseppe. Hey, Dr. Constant, how are you doing? My boy Vince is 14 years old and is having a tough time dealing with the acne that just started showing up on his face and back. Is there anything that actually works and helps get rid of it? Giuseppe, absolutely. There are many treatments for acne. And I just would like to take this moment to mention that pediatricians are well-versed in skincare and acne management. This is part of our curriculum in residency. We know how to treat acne. We know the new products that are out there. And we typically refer to dermatology when the acne is not controlled or they need a stronger medication or program or trials because of failed therapy. So a lot of parents come in and ask me, right off the bat for a referral to dermatology because their child has acne. But, I try to explain we can absolutely treat it. At your pediatric visit, please speak to your pediatrician about acne if your child is concerned or if there has been a new eruption. We can absolutely manage it. We can send medications and And we know how to manage the different forms of acne, and there are many treatment options. The first and easiest is that we use topical antibiotics. That is the first line therapy, a topical antibiotic as well as a benzoyl peroxide face wash. So we typically try to go with the basics and see if the first line defense works. Every child has a different form of acne or different severity. And at that point, we would assess what therapy needs to be used in order to treat the acne. But for your son, treatment is absolutely available, absolutely possible, and it does not mean that he has a lifetime sentence of acne. So please talk to your pediatrician. Okay, so we have a question coming in now from Facebook. It looks like Chen has a question. Hi, Dr. C. I've got another acne question for you. I just learned that there are two different types of acne, like having one type wasn't bad enough. What's the difference between regular acne and hormonal acne? Well, acne is short actually for the name of the bacteria that causes the cystic lesion on the face. And so inherently you have this bacteria and that is what is causing the eruptions on the face. But some children have more eruptions or more prevalence of this bacteria due to their hormonal levels. And so there are some kids that tend to have acne flare-ups during puberty or during the time of their menstrual period, or there are different hormonal factors that will actually cause it. And so we can sometimes control the eruptions by controlling the hormones. So as I mentioned before, there are topical antibiotics and topical therapies that can be used, but in some cases, you might not even need the antibiotics. You might just need to control the hormone levels themselves, thereby controlling the acne. So here, let's go through a couple of tips that I suggest for actually treating acne. First of all, you want to wash the face gently. It's very important to wash the face with a mild cleanser and warm water twice a day. And by the mild cleanser, I mean a cleanser that has an emollient, that has ceramides like CeraVe or Cetaphil. And also, once a day, you probably want to use a face wash that has benzoyl peroxide in it. Second is you want to use a dermatology recommended product, such as an oil-free or non-comedogenic skincare and makeup product. That way you don't clog the pores. This is for those females that wear makeup and that put something on their skin. You want to make sure that you're not clogging up the pores. Okay. Most importantly, you want to resist the urge to pick. Once the pimples are there is this urge to try to express them or pick them. And we really need to stay away from that for two reasons. Number one, of course, everybody has heard, well, if you pick, then you scar. Yes, absolutely. And you don't want to scar. But most importantly, when you pick, now you're opening up a wound. And when you open a wound, now you're open to infection. You're inviting infection to the skin, and you're also spreading the acne to the healthy parts of the skin. So all in all, you do not want to touch your face and you do not want to pick. So number 4, we want to make sure we keep our hair and oily substances off the face. Just like we wanted to look for oil-free products, you certainly don't want your oil-filled hair laying on the face, covering the face, and once again, clogging the pores. And finally, if your acne is persistent and fails regular treatment or first-line treatment, and your pediatrician feels that they have not been able to manage the acne, that you need higher level care, absolutely see your dermatologist. Okay, looks like we have another question coming in, and this is from our All Health TV app. This is from Sarah. Dr. Constant, my daughter has a tendency to get small red bumps after gym class. Are we talking heat rash or something else like folliculitis? Well, Sarah, yes. It depends on the age of your child. I don't know how old she is and where these bumps are, but absolutely folliculitis is very common, especially in teenagers. And this is basically micro abscesses on the skin due to sweating, due to poor hygiene, and sometimes clogging of the pores. That can tend to happen. The other concern, if it's not folliculitis, can be heat rash. Heat rash, I want you to know, resolves right away on its own. So during the time of heat exposure and sweating, it's red, might be a little irritated, and then it resolves on its own, and it shouldn't last 24 hours. Folliculitis is persistent and sometimes even has a head. They're almost like little pimples, so you can tell, and sometimes they're a bit painful. So please make sure to distinguish between the two and see your pediatrician if you have any questions. We're back, and it seems like there's still some questions coming in. Here's a question from Casey. Hi, Dr. Constant. Our toddler, Cora, keeps scratching what we think is eczema at night. I mean, she really goes to town on it. This is a twofer. What remedies can you suggest, and how do we know it's not something like psoriasis? So to answer your question, Casey, most likely this is eczema. I would suggest that you take a look at your daughter's skin. As I mentioned before, eczema flares tend to occur on the extensor surfaces, bilateral cheeks, and on the, maybe even on the hands. So you're looking at within the elbows, behind the knees, maybe some random patches on the leg. Psoriasis is a bit more chronic. It usually runs in the family and is usually thicker, and it's one solid area that is the area of concern. If you are concerned that your child has eczema or even dry skin, I would suggest first and foremost, you want to make sure that you're moisturizing your child's skin every day. You want to use an emollient that has ceramides because that locks in the moisture and it also repairs the skin and repairs the barrier layer of the skin. So CeraVe, Cetaphil are great, as well as the Roche-Posay. They have great emollients just to lock in the moisture and keep the skin healthy overall, whether or not your child has eczema. Second, you want to make sure your child is bathing once or twice a day with warm water. Hot water tends to dry out the skin, thereby making it very itchy and prone to scratches and cuts and skin openings. Those are the things that I would do. And then if there are eczema patches on your child that's really bothering her, and so much so that she's scratching at night, you certainly want to put a topical steroid, and that would be prescribed by your pediatrician. The reason for that is you really want to decrease the itching and the inflammation. As long as your child is scratching and itching, there's an increased risk for your child to cut the lesion open and then have a concomitant bacterial infection, which you certainly don't want. So we do want to treat with the steroids because you do want to slow down the inflammation and you want to stop that itching so that your child can stop scratching. If it's psoriasis, that is a different mode of their treatment, and that is something that your pediatrician would discuss with you and address with a dermatologist. Okay, so we have another question coming in now from Gabriel. Bonjour, Dr. Constant. My son fences on his school team. He's too embarrassed to ask himself, but he'd like to know what can be done about his athlete's foot and jock itch. What causes it, and are there creams or lotions he can use? Yes, what it does, regardless of the sport that your child plays, it is very common to develop these fungal infections in wrestling, football, track and field, fencing. These are sports where we have a lot of humidity in those areas. We wear non-breathable clothing. There's a lot of sweat, and that's a breeding ground for fungus to erupt. So you'll have these fungal eruptions, but they're treated very easily and they respond very well to clotrimazole. So for athlete's foot or jock itch, you can get Lotrimin over the counter and use that 3 times a day typically, and that should go away. If these rashes do not resolve to the Lotrimin, please contact your pediatrician. It could very well be something else. So please send in your questions. I'm here to answer them. It looks like we have a question coming in from Facebook. Perry wants to know, what's the safest way to treat impetigo at home while waiting to see a doctor? Well, Perry, absolutely, you are right. You've got to see your doctor for impetigo. Impetigo is dangerous. It spreads very quickly, and it is quite painful. So to treat it at home, you want to wash with soap and water, take a shower wash, dab the lesions, and then you can put a triple antibiotic ointment on it while you're waiting to be seen by the pediatrician, and maybe they would prescribe oral antibiotics or a stronger antibiotic ointment. And it's important to know that impetigo usually starts in the nose. There's usually a scratch or like a little crust around the nose. And parents might think it's just a little cut from wiping their nose, and they don't realize it's like the first sign of impetigo. And then impetigo spreads very fast throughout the body. Little honey crusted lesions is what we call them because they have a brown crusting, and that's from the pus that has erupted from the lesion. So it is important to note if you see a little crusting around the nose or around the lips of your child, please bring them in right away because it most likely is impetigo. Okay, so we have another question coming in. This question is from Christian. Hello, doctor. Are antibiotic creams safe for teen acne, or should we avoid them? Yes, if you mean the clindamycin ointment, yes, absolutely. Antibiotic creams are usually prescribed. They're not over the counter, and they are very effective for teens with acne. Now, some teens might need more therapy, like a retinoid, or maybe even oral antibiotics, but that would be determined by your pediatrician or dermatologist. But absolutely, you can use topical antibiotics for acne treatment in addition to washing the face and routine skincare. Okay, so it looks like we have a question from the All Health TV app, and this is from Jennifer. What SPF do kids and teens really need? And is mineral better than chemical? So SPF 30 is pretty much your best bet. I put SPF 30 on my kids every single day before they go to school, because as we know here in South Florida, all children are exposed to the sun every single day. So I want you to make sure that your child is protected on their face and exposed areas with SPF 30 every day. Mineral is far better than chemical because mineral is going to actually repel the sunlight from the skin and prevent your skin from actually absorbing that UV light. So it is important to find a chemical emollient that has SPF 30. Okay, so it is important to know that for routine skincare, whether your child has eczema, dry skin, or has perfect skin and doesn't really have a reaction to anything, all children need to be, and adults, need to moisturize on a regular basis. This is every morning and every evening before bed. In the mornings, I suggest moisturizing with an emollient that has ceramides and that has SPF, because like I mentioned before, all of us are exposed to the sun. So SPF 30 on the face, and for adults, not necessarily on the arms and legs, but for children, I would always say to cover the sun-exposed areas because they usually go to physical education or they're outside of school waiting for pickup or waiting for the bus. So definitely SPF in the morning. In the evening, after they shower, which is a warm shower with soaps that are unscented and gentle to the skin, and again, moisturizing soaps. Then when you're done, you want to pat them dry and again, put on an emollient before bed. Now, for those children that have eczema, you would add to that routine maybe a topical steroid if that is what is needed. But if not, you certainly just want to moisturize. Also, I want to make sure that our children with acne, please don't be shy. Don't be embarrassed to talk to your pediatrician about it. It's so important to treat acne. You know, acne has such an effect on our well-being, on how we feel about ourselves, our self-confidence. And as a pediatrician, I would hate to know that a child is suffering or is unhappy with their skin and they don't feel there's anything that could be done about it. Our job is to help you and to talk to you about whatever is, whatever might be bothering you or concerning you. So your pediatrician can absolutely help come up with a good skincare routine and prescribe products that could help you with your acne, whether it's hormonal or quote unquote regular acne. And finally, it is important for viewers to identify the signs and symptoms of allergic reactions versus a viral exanthem. Remember, viral exanthem are rashes that are caused by an underlying viral disease. So your child might have a fever or a runny nose or a cough, and then there's a rash that breaks out on their whole body that could be related to their viral illness. So we need to be able to identify the signs of a viral exanthem versus an allergic reaction, which what I mentioned before is an IgE mediated reaction causing swelling, redness, and even hives. So those are the two things that we need to distinguish between when we have a new onset rash on our child's body. So there's so much to go through with the rashes and the illnesses and the skincare, but we're here to guide you. And the most important thing is if you're not quite sure or something looks funny or you've never seen it on your child before, please contact your pediatrician and then we can go from there. We'll take a history and try to figure things out together. So if you have any other questions and I didn't get to them, please still submit them. We'll try to answer them as soon as we can. But I'm glad that you were able to join, and hopefully I was able to shed some light on the importance of skincare in pediatrics. I want us to remember that healthy skin leads to a healthy child, and a healthy barrier protects against invasive illness. Thank you for joining and have a great day.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.